Volume support ventilation, or VS, is the default ventilation mode on the Veta5. It is not the most sophisticated mode, but it's probably the most beginner-friendly option, and I recommend getting familiar with it before you try other ventilation modes. Before we get into more technical details, we need to understand that there are 4 kinds of breath: spontaneous, mandatory, assisted, and supported breath. Spontaneous means that the patient breathes when and how it wants. Mandatory means that the ventilator gives breath when and how it wants. During assisted breath, the patient initiates the breath, but the ventilator completes it, and the respiratory pattern and duration is defined by the ventilator. Now, supported breath is something different. It is similar to spontaneous breathing. The patient will initiate breathing and complete some or most of the work, but the effort is weak and tidal volume is not enough. The ventilator senses the beginning and the end of each inspiration by measuring inspiratory pressures and flows. Exactly during spontaneous inspiration, the ventilator supports the breath with certain pressure. Pressure support is terminated at the end of each spontaneous breath when the flows start to decrease. It is different from an assisted breath, which is forced on the patient regardless of the natural duration of the breath. Hence, the ventilator in supported ventilation mode can cooperate with the patient better than in assisted mode. I find that the VS mode can be very useful if the patient suddenly wakes up during anesthesia and starts breathing heavily, because the ventilator will follow the patient's breathing pattern without causing harmful pressures in the lungs. You may have realized that I used both terms for pressure and volume support. So what is going on here? In fact, the Veta5 machine is based on pressure support ventilation mode. The ventilator starts with an estimated pressure support, then measures the resulting tidal volume and modifies the pressure support to reach the desired tidal volume at next breath. In fact, volume-controlled ventilation mode is performed similarly with this machine. It is in fact pressure-controlled ventilation mode, with the pressures being continuously adjusted to reach the desired tidal volume. Now I will briefly discuss the VS mode. Before starting a gaze, you must enter the body weight here. In this case, it's 5 kg. The Veta5 will use the body weight to calculate the initial tidal volume, which appears here. The normal range for a tidal volume is 10 to 15 milliliter per kilo of lean body weight for healthy small animals. The default tidal volume calculation of Veta5 is rather conservative, as it starts at the low end. It's great because it's better to start low and increase it later on if needed. In this case, the tidal volume is 10 milliliter per kilogram multiplied by 5 kg, which is 50 milliliter. Hence, the desired tidal volume is set to 50, and this appears here. You can adjust it later on if you want by pressing this field, twisting this button, and press. Then you change the tidal volume setting from 50 to 70 in this case. The measured tidal volume is displayed here. So here is our intended tidal volume, and here is our measured tidal volume. Don't be surprised if the two do not match completely, and the difference between them can change from breath to breath. This is normal because the chest compliance of the animal is constantly changing depending on many factors, but spontaneous breathing effort will have a large influence on it. As you see the purple area on the graph, the animal just took a spontaneous breath and it got a pressure support. The next value here is the minimum respiratory rate. It means that if the animal doesn't take any spontaneous breath, the ventilator will give at least this number of breaths per minute. The default value depends on the body weight, but it ranges from 4 to 8 breaths per minute. I usually increase this number to 10 as soon as I start my case, and I will make small changes later on if needed. If you are a beginner Veta5 user, I suggest you don't change the PEEP and the trigger options. Most of the time, you will not need to change them for routine anesthesia of healthy animals. My name is Dr. Tamás Ambrisko and I'm a veterinary anesthesiologist. Thank you for watching.